Dr. Dane, and I wanted to give you a tip on how do you talk to a patient about lifestyle and wellness questions when they come in with acute care symptomatic problems. I get that a lot from chiropractors. How do you address their lifestyle habits when they really want lower back pain corrected, or they want their headaches or neck pain corrected? And here's how I do it. I think it's a great strategy to get to the underlying lifestyle issue while still making the patient understand that you really care about their acute symptomatic issue. And what I tell patients is say, listen, I'm going to ask you some questions, but it's important to me that you understand why I'm asking you these questions. And so I find that most problems in life are cause and effect. And in fact, you learned in science class that for every action, there's an equal and opposite what? And patients will always say reaction. And I'll say that's right. So what brought you into the office was your symptomatic issue, your lower back pain, right? But then you've got to agree with me, there's got to be an underlying cause to that. So if you look at my continuum here, there's a continuum between optimal function, because wellness and health are about 100% function, and if you were functioning 100%, you wouldn't have lower back pain or headaches or whatever they came in with. So there's a continuum between 100% function and optimal health, not 100% feeling, but 100% function, and also disease, right? And disease is where you're more acute in nature, kind of like you are now. You may be taking medications, your health is starting to affect the quality of your life, your potential is becoming limited. So you're somewhere between here and here. We know you're not here, right? But you're somewhere between here and here. Where you are on that continuum has everything to do with three stressors, right? And if I don't understand those stresses are in your life, I may never be able to help you with your lower back pain. Those stresses are physical stresses, how you move your body, your posture, repetitive movements, and what you're doing day in and day out. Your mental emotional stress, how you manage your thoughts, right? Whether you're happy, whether you have a lot of stress, whether you have a lot of anger, grief, guilt. And then finally, biochemically, are you eating a pro-inflammatory diet? Are you eating a diet that's going to nurture your body and give you the nutrients that you need so it's not feeding inflammation and pain-related issues? So I have to ask you some questions so I can understand your lifestyle and see if you're doing something outside of my office that may be precipitating this lower back pain that you're getting. Does that make sense? And it almost always does. The patient, oh yeah, well, you know what, if I'm doing something that's causing my pain, I've got to be able to help myself out. And that lends right into then asking them about their diet, asking them about exercise, asking them about repetitive postures. And that's the way that you can then address more of the wellness and the lifestyle management issues. Because let's face it, whether it's chronic disease or subluxation, it probably has an underlying cause. And that cause is probably rooted in their lifestyle. So do we truly want to address subluxation? Yes. But do we also want to make sure that people are living a subluxation or a chronic disease-free lifestyle? You bet we do. So this is Dr. Dane Donahue with a wellness tip for you. I also want to let you know that we have our Wellness and Practice event coming up at the end of June in London. Really excited about that, so please check that out. And then we're also doing a Wellness and Practice event, and these events are really to show you what the operational model of wellness is all about. What does it look like in practice? What do we do in our office, both clinically and financially, to create this operational model of wellness? So go to www.learn8ww.com for more information. Hope you enjoyed this tip.